says, and it's funny, but it's true. Live long enough and you'll get arthritis, skin cancer, probably one of the common chronic diseases like CHF, COPD, diabetes. At All County Healthcare, we teach you how to manage your disease. We make sure you know how to take your medications and how to recognize signs and symptoms before requiring hospitalization, no matter how many visits it takes. You didn't move to Florida to be sick. You moved here to enjoy the rest of your life. And that's exactly what our team of nurses, therapists, and aides at All County Healthcare help you do.
The following programming is furnished by you and your doctor.
The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Ant2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hi, everybody. I'm Greg Keeley. Welcome back to another edition of You and Your Doctor program, sponsored by All County Healthcare. Always here for your home care needs. Medicare certified, serving Miami-Dade, Broward, and Palm Beach counties for now more than 20 years. Rated 4.5 by Medicare.gov. Find us at allcountyhealthcare.com. Well, tonight our guest is family practitioner Osvaldo Alvarez, who practices in Atlantis at the JFK Medical Community. Sir, we appreciate you being on the program tonight and taking time out of your very busy schedule. Tell us a little bit about your background. You're originally from Cuba, right?
Thank you very much. Yes, I'm originally from Cuba. I left Cuba when I was 22 years old, and that was quite a bit ago. I went to medical school here in the United States and Puerto Rico, and ever since I got here, everything I've been doing is, related to the medical field, studying most of the times, and then doing clinicals in residences and all the process of the school. And then when I graduated 10 years ago, I started my working for some other practices, and we've just decided that it's better for us to put all our efforts in helping our own clients in our own clinic and practice.
Well, that sounds fantastic, and we're really glad you're here in the U.S. And what a contrast from Cuba to here. Tell us about basically how we benefit by having the health care that we have in America, and you're contributing to that.
Well, it's very interesting that we can connect the health of a human being, which, despite the differences that might be taking place into a different country, that we can, even though we were born in a different country, we take care of our patients in the United States. But the education that we received was from American schools, but we still have that Caribbean touch that we like to make our patients, our clients, to feel good, to feel really good, and to feel that they are being taken care of by a professional, a doctor, or a team, a whole team, the best possible way, so that they feel that they don't need to go anywhere else, that they feel that nowhere else they're going to be treated as they've been treated in our clinic.
And you certainly can't discount the fact of being bilingual here in South Florida. It's so very prevalent, and the fact that you have that adaptive ability is instrumental in a successful practice, I'm sure.
That is for sure a plus that our clinic and our team has. We are all bilingual over there, so we can focus on the two major populations that we have in the area. We have speaking English people, and we have Spanish speaking people that they most of the times they fear, and that's what most of the patients that we take care of in our clinic, they feel fear of speaking to a person who is not speaking their same language, the language they can understand, and the language in which they will feel more comfortable speaking to. And then that's something that it's very in the favor of our patients. They feel at home. They feel I'm speaking to somebody who speaks my language, and I'm speaking to somebody who will understand the language that I'm speaking, and that makes them feel good at the same time.
Yes, of course. And tell us what prompted you to want to be a healthcare professional? Was there something that triggered you along the way when you were in Cuba, or was that more when you were in the United States, or how did all that transpire?
That's an interesting question, because most of the people would say, well, it's because of the money. Money, it's there. It's obviously the money is not. I'm not gonna say that there is not money involved in the medical field. There is money, but money cannot be the first or the only thing that moves you towards being in the medical field, because it takes a long time before you start seeing money, because the career is a long career, and the passion of the healthcare provider cannot be just put on the money. It has to be put on somebody that needs you, somebody that has the need of somebody who cares for them, who cares for what they are going through, and it gives you some kind of that same reward backwards when you see that they are happy with the services you're providing.
Yes, that's such a great point. And it's the transparency when you're with a patient and they see your passion and they see your ability to communicate with them about the importance of, helping with their everyday healthcare needs. That's a really significant thing for people to have, and knowing that their care provider isn't just in it for the money, but it's because they have a passion for providing care for those who they serve. So that's very admirable.
Absolutely. Thank you.
And so you practiced at Larkin Family Medicine Center, a very progressive organization. Tell us about that experience and how that may have shaped you as a practitioner.
Being able to practice in the KFC plaza, it gives you the opportunity to take care of those patients that really fear the language barrier, because in the area there is two letter professionals, health professionals who speak Spanish. So most of the patients that I've been taking care of in the clinic, that's the one thing that they mention. Well, thanks God I have somebody who speaks Spanish, because I was hospitalized and I couldn't speak to anybody in Spanish in there, and that's a horrible situation when you are in pain or when you are in a need and you don't have anybody to communicate properly. So in that area, we are planning to render that service, that need, to make them feel that they are being understood.
It's really difficult to imagine being in that situation, and those who are basically in charge of your life, they can't understand you. And so thank goodness that you're here in South Florida to render that service to people who need it most.
Thank you.
And so really you've treated a full range of patients then, from women's care, psychiatric, and overall general practice. So anyone seeking basically any type of care could receive, family practitioner treatment.
Yes, it's we're trying to render a holistic medicine in our clinic, trying to to cover basically all the needs of the patients, from 19-year-old to the entire adulthood, and to our elder population as well. We try to take care of all the bases in our office. Trying to see whatever medical need the patient has at the moment. We try to integrate it to our team, and then we just focus on their needs and target their necessities.
Of course. And so quite an array of services that you're offering here. And the one that kind of stuck out to me first initially was laboratory. And, laboratories seem to be popping up all over South Florida, and with different kinds of, tests, and their advertising. And how do you really know what you're going to get when you go to your laboratory?
It's it depends on certain things. The first thing we do is to interview the patient. We assess the patient. We know what their past medical history is, their present condition, what brought them to the clinic. And once we have them over there, then we make a decision on what's the road that we need to take care after that. So if we decide that we already make a decision, we are going to have this lab work done, then we have it right there. We have it in our clinic. There's no need for the patient to go somewhere else and do a whole other line, or lose one more job day, because sometimes it brings economic situations to the patient. So the patient will just have one day, one stop, and we'll get most of the services done under our services right there.
Mm-hmm. In terms of progress, just for humanity, essentially, what are your thoughts about genetic testing? Do you see that as becoming more viable in South Florida?
It is. It has become more viable, and it needs to be more viable, because that's something that will help us understand and know our patients in a better way.
Mm-hmm. And so really that diagnostic tool of genetic testing will be invaluable to folks down the road. Do you see that as being something that will be available to more people moving forward?
It's hard for me to say if it is going to be available for more people. Of course, we would like to have it available for everybody, and that's one of the things that we try to do in our clinic is, for those who don't have health insurance, or that they don't have a very good economic situation. So there is a plan that we offer in our office that helps them, with those diagnostic tools that we implement in our office, so we can help them as well, not taking into consideration if their migration situation but do taking into consideration their economic situation, having a very good price for those who cannot afford health insurance.
Oh, that's really good to know, and reassuring for so many people, because if you don't know exactly what's happening with your body, how do you know how to treat it? So that's really refreshing to hear.
Exactly. Yeah. The very first thing we need to have in mind is how the patient, knowing the patient, knowing what he's feeling, what we can feel ourselves while we do our assessment, and then what we can see through the lab work, so that we can further move in the treatment of any condition that they might have.
What a really great philosophy for providing medical care for people. And speaking of which, it also listed on your brochure minor surgeries. And again, it's nice to know that you could go to a practice and someone as experienced as you could take part in minor surgeries and help them basically get back in the game more quickly. Could you provide an overview of those minor surgeries that you do?
Sure. Yeah, sometimes you go to a primary doctor, and you are concerned of your health. We do take care of past medical histories. I mean, if you're hypertensive, if you're diabetic, we take care of those through medications, through diets, through exercise, through lifestyles. But there is one tiny thing that's kept you busy thinking of that little skin tag that you have in your neck or in your face or in your back, and it's bothering you, but you don't have the time to, go to a dermatologist to remove it, or you don't want to do it. And then that's one thing that we could just, take care in our clinic. We could just remove that skin tear, depending, after the assessment that we do, if we decide that it's something that it's safe for the patient, that it doesn't need to be necessarily taken care of by a dermatologist, then we just go ahead and remove it over there in our clinic.
Of course, and that would be a wonderful convenience for people to have. But still, at the same time, you have the judgment that is, critically involved in making sure that, you refer out properly for something that, might be a little bit more, and challenging and maybe beyond your scope. So absolutely, that sounds fantastic. And so regarding ultrasounds, then that was another key component for your practice, and we'll get back to that just when we come back to the program with this fine physician. We'll be back right after this.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
And we want to make sure that we share this gentleman's place of practice in Atlantis, located at 5511 South Congress Avenue, Suite 101. That number that you may call to schedule an appointment is 561-469-7190. Well, welcome back again to the program. And this gentleman just began talking about ultrasounds and the practical applications of those in terms of diagnosis. Talk about how your practice generates information about that for proper diagnosis.
Yes, I'm going to talk about the ultrasounds, but I also wanted to mention some other tools that we also offer in our clinic. From the dispensary, we have a medication dispensary, our little pharmacy in there. So when the patient goes through the whole process, they go through the medical assistance and the triage system, then they go to the doctor's office, we assess them, we diagnose them, we do the lab work, then the patient needs medication and the medication is right there also. We have the medication for the patient right at the office, so the patient does not need to go anywhere else to get his or her medication. Medication will be dispensed right in our office. There is other tools like the ultrasound that will give us more details about any of the medical condition that our patient may have, as well as the laboratory room where we're going to be drawing the blood to the patient to help us in the diagnosis of certain medical conditions, and the ultrasound will just help us in determining certain conditions the patient may have, not just like the blood work. The blood work will be just a generalized tool that we will use, but in this case we'll be using the ultrasound as a generalized tool and also a more focused tool. If a patient has an abdominal pain or has a leg pain or has any different kind of pains, a tool that will most likely be helpful for us will be the ultrasound. And again, the patient doesn't have to go anywhere to get that test done. It will be done in our office right there.
Practically one-stop shopping there. That's fantastic. And the dispensary, again, I wasn't aware of that, and so what a nice convenience that is to not even have to necessarily bother with the pharmacy if you're a busy person. And so that is really a key element of your practice. That is outstanding. And so really the other things that you do and do well at your practice, there's something called PRP, platelet-rich injections, and that has become more prevalent too. Talk about that and how that applies to your practice.
You know, with time, with age, a lot of issues come along as well. One of these very incapacitating issues is knee pain, any kind of articulation, any kind of joint pain that will keep us away from whatever we like to do. It might be our job, it might be our hobbies, it might be a simple thing as just bending over to do something. A pain anywhere is something that we don't want, we don't like. And the PRP process, it's a procedure that is simple, and we'll do it in our office to improve the health of those joints involved in a painful procedure, in a painful process, you know. So if one of our patients is complaining of any kind of joint pain, we will first of all assess the kind of pain, assess the safety of the patient's come first, and then if we make a professional decision that the patient will benefit from those procedures, from the PRP procedure, then we will most likely go ahead and give the patient the treatment in the office.
That's so convenient. And so regarding screenings, we're not a young bunch down here in South Florida. We have to start, checking our health at various stages of life. The age of 50 is kind of a magical age for some folks, particularly men getting specific screenings. Can you talk about the importance of screenings?
Oh, that's very, 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 very important. It's a very key factor in the care of the health of any of our patients, because by screening you can prevent conditions, and if you prevent conditions, you improve the quality of life. You prevent the patients from taking or adding more medications to their lifestyle, which I've seen patients that they have lots of medications, and that's it comes from our Latin culture. We don't screen, we don't like going to the doctor until we feel that we need to go to the doctor. So I encourage all our clients to go through that process, to screen, to go to different ages. When you reach a certain age, we need to screen you for certain conditions, so that if you don't have it, then we stop it, and we can prevent the conditions.
And
the phone number on the other.
So yeah, would you like to tell us what your information is regarding your telephone number and your address, etc.?
Absolutely. Yeah, if any of you would like to go to MD Access Medical Center, it's very important that you give us a call at 561-469-7190. Our address is 5511 South Congress Avenue, Suite 101 in Atlantis. The reason we want you to call our office is because we don't want you to be there forever in our clinic, in our waiting room. We want you to be there the less time possible, so that you go there. If you have an appointment at 2, we will try to take care of you at 2, and we just go through the whole process as fast as you can, so you don't have to be in there for the whole day waiting in our office. We will take care of your health in the best timely manner.
Thank you so much for that summary, and we certainly appreciate you being here tonight. And so as we wind up our broadcast, we at All County Healthcare appreciate the opportunity to care for you and your loved ones now for more than 20 years. We cover Miami-Dade, Broward, and Palm Beach counties. We are Medicare certified and are ACO partners for Palm Beach County with a Medicare.gov rating of 4.5. Each and every day we work tirelessly to help providers to reduce hospital readmissions rates so that our friends and neighbors can live longer and live better. During this critical time of COVID and dealing with the often severe respiratory illnesses, please look at our website to learn more about our IPV therapy, which interrupts the vicious cycle when people are having difficulty breathing. Our skilled team of nurses can assist you with this serious issue and can make a positive difference in the lives of patients whom we serve. Our website is allcountyhealthcare.com. This concludes our broadcast for tonight, and we'd like to thank again this gentleman, practitioner Osvaldo Alvarez, available to serve us.
Thank you
at
for
his
letting us
practice
share with
in
you
Atlantis.
a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life. The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.